Everybody, I'm Tina Plemons. I'm a clinical pharmacist by day and a coach at Locomotion Fitness by night. I wanted to hop on here and show you my medicine cabinet. So I wanted to just show you what I take on a daily basis and kind of as needed. It's not a lot, so maybe that's surprising to you, maybe it's not, but let me show you. Also, I want to point out that my medicine cabinet is in the kitchen. It's not in the bathroom where humidity can possibly degrade the medicine. So my biggest PSA to the entire world is if you have a medicine cabinet, please keep it at room temperature and where there's no humidity. So let me show you. So I will tell you this bottom shelf is for my dogs. Sorry, I'm not sorry. And this middle shelf is all for humans. So things that I take on a daily basis. The first one is a fish oil. So this isn't my favorite brand of fish oil, but Kirkland is actually a really good brand to use just because it's not very potent. So to get the dose, I usually try to take 3,000 milligrams of EPA and DHA together per day. To get that dose, I'd have to take many, many capsules of this, and they're kind of big and hard to swallow. So I'm really just trying to use this one up. But I will say invest in a good quality fish oil. Fish oil has a lot of healthy properties for your heart, lots of healthy good oils, so definitely take a fish oil. Next is my multivitamin. So I take a prenatal. This one's just run of the mill from Amazon. I like it because it's chewable. So these are chewies and they taste really good, so it's not like I'm taking medicine. I think everybody could benefit from a prenatal vitamin. It just has usually higher quantities of each of the essential vitamins, and it has more folic acid, which I think everybody could benefit more from. So I will say that your diet could have a lot of folic acid in it, and that's great. And you can't out-supplement a bad diet. So essentially anything that you get from your diet is much better than if you take it in pill form, but I like to just take it prenatal just to make sure that everything is covered. The next is D3. So there's different versions of vitamin D. D3 is pretty well absorbed, easy on the stomach. This is pretty potent. This is 5,000 international units. Usually it comes in 1,000, 2,000, or 3,000. So I take this with my fish oil. It's better absorbed whenever you do take it with an oil or fatty substance. So I just take one of these a day. Low vitamin D levels have been linked to a lot of health concerns. So it is just better to supplement. I don't know my vitamin D level, but I would encourage you to check your vitamin D level if you see the doctor regularly. That being said, vitamin D, it's kind of expensive, but it's not terrible. But overall, it's a really good vitamin to take. It is fat soluble, so you could potentially overdose on it. That's why it's better to have your vitamin D levels checked by the doctor just to make sure you're not taking too much. And if you're very deficient, then you have to actually have prescription vitamin D. So just something really important to keep in mind. The last of the ones that I take on a daily basis is a probiotic. So this is pretty new to me. I just started taking it. I got it from my acupuncturist. So it's pretty good so far. Usually probiotics, you have to kind of taper up the dose and then you taper down on the dose. But probiotics are good overall just for your gut health. So that's all the things I take on a daily basis. And now we're going to move into things that I just have on hand in case I need them. If I have stomach upset, I take Pepsid. So it's only as needed, just for some GI upset, those types of things. The next group of medications are really important and kind of what I wanted to talk most about today. So analgesics, Tylenol, ibuprofen, Motrin, Aleve. All of these medicines are over the counter, and if they're used inappropriately, they can be very dangerous. So the first one we'll start with is Tylenol. So this is just generic. This is extra strength, 500 milligrams Tylenol. It's very important that you don't take more than the prescribed amount. So over the counter, they recommend no more than 2,000 milligrams or 4 of these per day. So prescription, your doctor can let you take up to 4,000 milligrams, but truly you shouldn't be taking this on a daily basis unless your doctor tells you to do so. Tylenol is better for joint pain or arthritis, and ibuprofen or Motrin, the NSAID group, is better for muscle pain. So we also have those as well. Ibuprofen, the over-the-counter strength is 200 milligrams. You can get prescription strength that's up to 800 milligrams, which would be 4 of these. But again, you should only take the prescription strength if your doctor tells you to. So ibuprofen can be very, very kidney toxic if you take it on a consistent basis. So you need to take this with food. It can upset your stomach, so try to take it with some kind of calories in your stomach to protect it. But ibuprofen you should not be taking on a daily basis. It can also somewhat thin your blood. So if you take it before you go to the dentist, for example, like I did last time, it'll make your gums bleed a little bit easier, so just be careful with that. And then I also have migraine relief on hand, so this is generic Excedrin. It has Tylenol in it, but it also has a low dose of aspirin and caffeine. So again, it can thin your blood slightly, and if you are taking an aspirin daily for heart health or preventative, then you need to be aware that this also has aspirin in it. So Excedrin is very similar to even Goodies powders that my husband loves to take that are terrible because of all the aspirin. So just be careful, whatever you use. I try to avoid using any of these if I can. I only take them if I truly need them. So I would encourage you to do the same. And if you're finding that you're using them more days out of the week than not, in terms of soreness from working out, or if you have headaches more frequently, you should really talk to a doctor. You shouldn't be dosing these yourself at home because you have an ache here or there. I really encourage you to see the doctor. So the next group of medicines are whenever I feel like I'm starting to come down with something. I do work in a hospital. I'm around a lot of germs, so I try not to get sick. So if I start to have a tickle in my throat, I take a vitamin B stress complex. So it's just high doses of vitamin B. Vitamin B is a water-soluble vitamin, so you essentially can't overdose on it. Your body will just eliminate what it doesn't need. So that being said, your urine could be a very bright yellow color if you take one of these, and it also kind of smells a little bit just because of all the vitamin B. This also upsets my stomach, so I take it with food just once a day whenever I start to feel sick. And then also, if I start to feel sick, I do take Emergency. So vitamin C can help kind of combat some of that illness. And then Sudafed is what we always have on hand. I take the immediate release formulation just as needed. I'm young and otherwise healthy, so I don't have any contraindications to this, but if you are on other medicines or have a heart history, you may not want to take Sudafed, and definitely talk to your doctor. So these are some things that I take if I am having some trouble sleeping. Luckily, that's not a big problem for me, but I have some magnesium on hand. So this I take at bedtime. You can also get it in a liquid formulation or a powder that you mix. So magnesium is really good. There's not a ton of harm associated with it. It causes some GI upset, may cause some diarrhea, that type of thing. But usually just one pill a day is fine. And then melatonin, I also have this on hand mainly for the dogs because it helps them sleep at night. But melatonin I take if I'm off on my rhythm a little bit, like my sleep schedule. It can help you get back. So with melatonin, it's really important to remember more is not better. Less is more. So you should not be taking several of these tablets at night. I find people all the time that feel like melatonin doesn't help, so they take a handful of it. But truly that's not helpful, and it's actually harmful to you. So everything else I think in here, I have some inhalers for my husband just on hand. I also have some Tiger Balm. This is really helpful. Oftentimes I can get away with using Tiger Balm if my muscles are sore instead of having to take an ibuprofen. So definitely anything topical is better if you don't have to take something by mouth. So less toxic, but just be careful with this. It is really potent. So make sure you wash your hands after. Don't touch your face. Don't touch your eyes. There's a reason it comes in a small container because it's very, very potent. So that is all the things that I take on a consistent basis. So those are all the tablets and capsules and things that I take for different things. I also do take some different supplements in my coffee in the morning. So I use a collagen protein. Vital Proteins collagen mixes really well in my coffee. It's not a complete protein. It's truly just some of the additional amino acids that your body can use, so I just like to use that for my skin, for my nails, but there's not a ton of evidence to support it, to be honest with you. And then I also use MCT oil in my coffee. I do like to have some fat in the morning to kind of stave off my hunger a little bit, so again, it's really easy to mix in my coffee. So I just put it there, and then I drink my coffee on the way to work. So that is all that I have. If you guys have any questions, I'm more than happy to answer them. If you can't tell, this is a really big passion of mine, not only professionally, but personally. I think that people need to be smarter about what they're putting in their mouth and understand the risks and benefits. So if you have any questions, please don't be afraid to reach out. Thanks, guys.